Hey guys, so in today's video I wanted to tell you guys how my first day of occupational therapy treatment went. So yesterday was my first day, as I had mentioned, and we did some interesting things. Some I was expecting, some I wasn't. Some we had kind of discussed like last week when I went in to do my initial evaluation, but basically, yesterday, the first thing we did was we kind of talked about if there were any changes with my health status or anything or my pain levels over the weekend. And there wasn't really any new changes that I had to report to my occupational therapist. So that was basically it. After that, we had a discussion of kind of what the goals were going to be for the day. The one thing that I don't like compared to inpatient rehab is that, like, at inpatient rehab, my occupational therapy was an hour and a half long, and outpatient rehab, my occupational therapy is only 45 minutes sessions. So it's a little bit less. And honestly, I think it would be much more helpful if it was able to be a longer session because I feel like we could get more done. Because honestly, yesterday I felt like we just kind of got started with everything when it was basically time to go. So I'm going to go over everything that we kind of did during the session. And I'll tell you that it felt like time just flew by. And I don't know if that's because, like, the fact that I'm kind of stuck in the house or what, but like it felt like time just flew past. So the first thing we did was she wanted to see how long I could stand for, because for those of you who don't know, even though I'm not able to walk, I am able to stand and just put most of the weight on the left side. I did work when I was in inpatient rehab. I worked with physical therapy on kind of shifting my weight from foot to foot and side to side. But she wanted to see how long I was able to tolerate standing because she wants to be able to increase my endurance with standing so that I'm able to like start to cook things, use the sink, wash dishes, things like that. Even though we have a dishwasher, these are things that we want to work on while I am doing occupational therapy. So the first time I stood at the edge of the sink, she kind of just had me holding onto the countertop with my hand, my good hand, obviously. And the first time I stood up, I lasted for 4 minutes and like 30 seconds, somewhere around there, that amount of time. And she asked me if I wanted to try again. And so I definitely did. And I said, just give me a few minutes to rest and then I'll try again. So the second time, after sitting in my chair, my wheelchair for a little bit, the second time I stood up, I was able to last for just under 7.5 minutes. So that was definitely an improvement. So I'm hoping, like, based on her after visit summary and her notes, like, I'm definitely improving based on that. So hopefully insurance sees that and is able to look at things and see that, like, I'm doing a lot of work and I am doing my absolute best at these therapy sessions so that I can continue if needed past the 20 visit limit that they put on it. Because that is what my insurance has limited us to, is 20 sessions. I'm sorry if I said 20 minutes. It's 20 sessions that they put as a limit for my occupational therapy. Like, the total number of sessions that I was approved for through insurance was 20. So we shall see. Like I had mentioned in a previous video, she did say that insurance usually is more than willing to approve more sessions if you can show improvement during your sessions. So hopefully they can see that, I was already improving just from the one session. So then after that, we kind of went through a couple more questions, and then we went into the physical therapy gym, which was a super nice gym. It was bigger than the one at inpatient rehab where I went, and it was a little bit nicer. There were probably, compared to the 4 mat tables there were at inpatient rehab, there was about 6 or 7. and there was a lot more exercise equipment as well as a walking track along the outside of the physical therapy gym. We basically went in there to sit on the edge of a mat table. She had me transfer from my wheelchair to the mat table. The mat table, for those of you who don't know what a mat table is, it's basically like a flat table that it has a cushion on it, and you're able to sit on it or lay down on it, and they can do treatments, whether it's occupational or physical therapy. We did kind of talk about doing some strengthening exercises for my good arm, just to make sure that we keep that arm as strong as possible since it's doing a majority of the work right now, since I'm not able to use this arm over here. But, you know, we did work on we did some bicep curls with a 5-pound weight, which isn't much, but when you are doing all of the work with one arm, it is a lot. So she also had me doing like this type of a motion, which I started hearing a crunching sound in my shoulder, and she touched my shoulder while I was doing that motion with the weight, and she told me to stop because it felt really weird, and she said it felt like something was rolling in my shoulder, which is weird because I had surgery on this shoulder previously and didn't have any problems with this shoulder previously, but now it's acting up. So she was wondering if maybe I wasn't like overusing the shoulder because it's having to do so much work because of compensating for this one not doing much, or not really doing anything at all right now. So yeah, basically that was pretty much it, other than she had me scoot from the right to the left side of the mat table, and then from the left back to the right side of the mat table. And then by that time, like, our 45-minute session was over. So I don't know what we are going to work on tomorrow, because today I don't have any therapies, but tomorrow I do have occupational therapy again. It's not with my regular occupational therapist, but I am seeing a different one. I think my other occupational therapist had a different appointment with someone else already. So that was just the time that they had available with I think she's an occupational therapy assistant that I'm doing my treatment with tomorrow. So we shall see what we do then. Let me know if you guys would like me to talk more about what I'm doing during occupational therapy. And I'm really hoping that they are able to get me into physical therapy soon, because I don't want to lose the function that I already have. I've talked about this in multiple videos now, but I really don't want to lose the function that I already have because we're waiting so long to get me into physical therapy. And it's not my fault. Like, if I had my way, I would have started with physical therapy and occupational therapy at the same time, but they don't have the availability to get me into physical therapy right now. So my main focus currently is occupational therapy, where, like I said, we're working on my endurance as far as wheelchair transfers. We are working on my standing endurance so that I am able to stand up at the sink. We're working on balancing so that I'm able to turn the sink on without losing balance, because right now I can turn the sink on, but I lose balance when I let go of the counter. So we're working on things like that, because we want me to be able to cook and cut vegetables and wash dishes or fill up a glass with water, things like that. So let me know if you guys would like more information on the things that I'm working on in occupational therapy and more health updates. Let me know if there's any other topics you guys would like me to discuss on my channel in the future. I would be more than happy to do so. And with that being said, that's all I have for today. So I will see you guys in my next video.